Yes, so ladies and gentlemen, let's get straight to it. Last session we discussed about general examination together with history taking. So today we're going to go through systemic exam and we're going to cover the respiratory examination. So what are things that you need to consider? So you need to become well prepared with all your equipments. So you need your stethoscope for this case, your pulse oximeter, your BP machine, and all the necessary equipment which you need for this exam. And then you should make sure that you create a good report to your patient. Introduce the patient to the examiners. You see. And then after that, make sure you get the consent. And then make sure you assure confidentiality without forgetting to explain every step that you take. So if you want to do a certain step, you tell the patient that right now I'm going to do this and this. Will you allow me to proceed? And the patient can actually allow you to go on. So this is just the things that you need to prepare yourself with. And that's actually very important because they matter a lot. So the first thing that's important is the inspection of your surroundings. So this can tell you a great deal about your diagnosis of the patient, and also it can help you to pick up some things which will aid you in the diagnosis of the patient. So what are things that you're supposed to look for? Maybe the patient may be on a pulse oximeter. You probably know that this person maybe is having respiratory distress. Maybe that's why the pulse oximeter is being used to also check the oxygen saturation. Some of them just be put on a monitor, which shows all the vital signs. So sometimes some of the vital signs can actually be alarming to you, and you can actually take a good note of that. And you can find that some bedside examinations like ECG machine, which is there. So maybe this can tell you that maybe this patient is also having maybe cardiovascular causes which can affect the respiratory system. So after that, you check the surroundings of your patient. So that means you want your patient to be seated, probably an angle 45 degrees. So seated, and then check around the patient. So you're going to tell the patient, excuse me, I'm just going to check around your surroundings. Do you allow me to proceed? Then yes, I proceed. You should check for different types of things. Maybe the patient may be on a ventilator. The patient may have a chest tube drain. Maybe suspected this patient had a pleural effusion, so they're trying to take the liquid out, the water out. Maybe the patient is under medication. You check the type of medication. Maybe the patient is under nebulization. And maybe the patient is having oxygen therapy. So he's in an oxygen mask and he's getting oxygen. So all these can tell about the great ideal of the diagnosis of the patient, but also the critical position of the patient as per that. So I hope we're together until there. So after this, we're going to go to the second thing, which is about you inspect the patient now. Inspect the patient. So this is another step telling to the patient that right now I'm going to just inspect you and look for some things which may help us in your diagnosis. If you allow me to agree, then yes, the patient will give you the go ahead. So the patient is in a seated position. You start inspecting the patient. The first thing you want to check is for any signs of respiratory distress. So the position that the patient is taking can tell a very great clue. For example, if the patient is in a tripod position, this is a sign of respiratory distress because it's like he's seated but he is like this. So sign of distress. And then other signs of respiratory distress, maybe the patient has nasopharynx. And this is also a sign of respiratory distress. Maybe the same patient is having the signs of use of accessory muscles. In respiration. So there's that extra effort that the patient has to use in order to actually breathing in and out of air. What else? You can find also the patient is having a pursed lips. So pursed lips is like, so that's also a sign of respiratory distress. And also you can find that patient is actually tachypneic. So you can see actually upon the breathing pattern of that patient, you can actually note those very important things. So without forgetting, something that I forgot to put you through before this, upon the checking of the surroundings, please don't forget about the sputum pots, because maybe this patient has been given that for the case of for the sputum sample that's going to go to the lab for further analysis. Maybe you're suspecting this person is a TB patient, or maybe there is something else that you want to pick up in the sputum. So these things are very important for us to keep note of. And the same thing of like noting about the inspecting the patient. Now you're going to start the inspection of the patient, especially from the hands. So you inspect the patient, you start from your hands. So what are the things that you're supposed to pick up? So from your hands, you can check for palmar paleness. You can also check for cyanosis. So cyanosis, the bush discoloration, you find it in the fingertips most of the times. You can also check for finger clubbing. So finger clubbing can alert you of different cardiovascular and lung diseases. You can have endocarditis. You can have TB malignancies. And so many other things that you can also cover. So this finger clubbing, there's something called the Shamroth window, which is obliterated in people with such conditions. So upon doing the finger clubbing examination, so this Shamroth window that you see that your fingers actually making for a nail bed, they're going to be obliterated. See, so you've checked for your what? For check for your finger clubbing, and then after that, take a note of the pulse of the patient. Yes, take note of the pulse rate. We're going to examine the radial pulse. So you're going to comment on the pulse rate upon measuring the pulse rate by using by taking over 60 seconds, and then check about the rhythm of the pulse. You check about the synchronicity of the pulse. You check about the volume and the character of the pulse. So these ones are actually very important for you to actually take note of. And then there's another thing you should take note of, which is the carbon dioxide retention flap and the salbutamol one. Yes, so in this part, you're going to tell your patient to actually just put his hands open like this, and then you're going to check for any signs of tremors that you see. So in case of carbon dioxide flap, you find that patient is actually tremoring down like this. So this is a case of carbon dioxide retention flap. But in case for salbutamol, the direction goes like this, like a picking type of what? A picking type of emotion that the patient goes on to. Yes. From then, I think it's actually well understood. Yes. From then, you go on and check for the jugulus venous pressure. So the jugulus venous pressure, you're going to check it. Of course, it's going to be, and this is called the jugular venous pressure, and you're going to check it in the sternocleidomastoid muscles, especially in the top borders. So when you have the clavicle, and you have the first border, and the lateral border, and then the medial border, and then you have the lateral border. So at the place where there's highest pulsation, that's what you're going to check for the JVP. So the JVP is elevated in the following conditions. So JVP is elevated in the following conditions. A. So you can have right ventricular or some right-sided heart failure. So you find the JVP is really elevated. The area of maximum pulsation is really high. And then you can have tension pneumothorax. Yeah. So these are just some of the conditions in which you find the JBP is elevated in your position, in your patient. And it's very, very important for you to take a good note of that. So after that, you can go to the inspection of the face. You check for the deviation of the trachea. Yes, deviation of the trachea. Yeah, this is very important. You want to check if the trachea is actually deviated away or towards. So what are the conditions where the trachea will be deviated away? So it's deviated away in the cases of tension pneumothorax. So that means that side that has the tension pneumothorax will make the trachea to deflect on the opposite side, together with pleural effusion. So these can be actually signs of these problems if the trachea is actually deviated. So you're going to
clavicular heads. Place your index and ring fingers on the two heads, and your middle finger, you find the position of the trachea and have a look if it's in the midline, because you should be able to see if it's deviated one way or the other.
Towards, what are the conditions which will make the trachea or actually divert towards? So you have conditions such as lung collapse, and when someone does pneumoctomy, so just maybe a dissection of a lobe of the lungs, maybe due to a certain malignancy, which has actually been found in it. So that's about the deviation of the trachea. So now we go to the next part. I hope things are actually going on well and you're moving along with me. The next part is you inspect the face. Yes, so you inspect the face. So in this thing, what are you going to check? You're going to go to the eyes. You're going to check for paleness, conjunctiva. And then after that, of course, you're going to tell the patient to look up while you have your eyes pressed. So you're going to take a good look at the conjunctiva. And then you're going to take note of your mouth. You're going to check if there's pursed lips. And then you're also going to check for what? For central cyanosis. So in this central cyanosis, obviously, you're going to tell your patient to actually open the oral cavity and then lift up the tongue. So you're going to check underneath the tongue for central cyanosis and also for tongue pelvis. And they're going to check for the mucous membrane in the tongue, in the oral cavity, for any signs of dehydration. And then also take a note of a smoker's face, something called smoker's face. So you have a patient you suspect having lung cancer or having lung problems, which is secondary to smoking. Then you find something called smoker's face, whereby their face tends to be very red, especially near the eyes and the cheek areas. Redness, and this is due to the fact that there will be increase in supply of blood towards those areas. So those areas are actually affected more. And then there are also some cases of superior vena cava. So redness can also show superior vena cava obstruction. So yeah, these are the things that you're also supposed to pick up. I hope we're together until that particular moment.
That marks the end of part 1. For part 2, kindly follow our page on YouTube, +255 Health. Make sure you subscribe and turn on that notification button.